Hi, my name is Vince Curtis, and I'd like to welcome you to Affordable Care Consultants video presentation. In most cases, we lead very successful, busy lives. And when it comes to healthcare, like most of us, we don't have the time to navigate through the Affordable Care Act and the hundreds of other insurance sites to determine what is best for us and our families. As employers, it would be nice to offer healthcare to attract, appreciate, and retain the best talent, but it just hasn't been feasible until now. You see, right now you are in a very unique position. In the next few minutes, you will discover the health secrets that put us in a very strong position financially, productive, and compensation-wise. This video and its secret strategies will forever change the way you see, implement, and utilize healthcare from this day forward. These Fortune 500 companies all over the US and many more are utilizing exactly what I'm about to share with you and have been using this successfully for years. Companies like AT&T, Metro PCS, The Home Depot, Pepsi, BMW, Wells Fargo, Penske, and even the Hospital Corporation of America. Every single one of them has all seen this as the best solution available. They have found that by taking care of the core reasons we all use healthcare also protects us from the high deductibles, copays, and coinsurance that we leave ourselves at risk for. And equally as important, it protects us from the loss of perhaps our most precious commodity, time. So let's take a look at that. Does this scene look familiar to you? When you or your children are sick, are you increasingly wasting more personal time and lost work hours in the waiting room of the primary care office, MedFirst clinic, or local hospital ER? Because right now the average time spent in a primary care office or MedFirst clinic is a minimum of 2 hours and 6 hours in a hospital ER, all to be seen by the doctor or practitioner for no more than 5 minutes. And what if someone gets sick after hours or in the middle of the night? Because other than a costly MedFirst clinic or ER, the doctor is only available for 40 hours out of a 168-hour week. Or do you just bring your illness to work and cause a chain reaction? Last year, there was a shortage of 40,000 plus primary care physicians in the U.S., and the shortage is expected to reach 65,000 by the end of this year and as high as 130,000 by 2020. This is mainly due to the huge upfront deductibles we are seeing and concern by those doctors for patient payment. Therefore, access to doctors will require much greater wait times, probably double or triple, and actual visits to the doctor will have shorter durations. And that's if a doctor is available. Be ready to start experiencing misdiagnosis more frequently because more of our care is being handled by nurse practitioners who are already trying to fill that void. On top of that, the Affordable Care Act will add an estimated 30 million people to the healthcare system by the end of this year. With more people to care for and less doctors, do you see wait times getting any better or worse? So what's the solution that the thousands of businesses and millions of individuals discovered? They discovered what the Kaiser Family Health Foundation has said for years, that 78% of the reasons anyone goes to an ER, MedFirst clinic, or doctor's office, it would be better handled in a different way, reducing downtime and healthcare costs, increasing production, and acting as the first line of defense in protecting your family better than ever before. That's 4 out of 5 times we need a doctor. Now, when someone gets sick, they just pick up the phone and call or use a computer or phone up at any time from wherever they are. Request a telephone or video consult with a doctor without a copay and can even schedule a specific time for the consult. The doctor will call back together with your medical records in front of them, usually within 20 minutes or at the specified time. After diagnosis, and if necessary, the doctor will call in a prescription at the nearest 24-hour pharmacy, wherever you are, in any state where you can get it filled right then, at any time, day or night, at a huge discount. The result is you get better faster. And we go a step beyond that because we will send you a follow-up email within 24 to 48 hours to make sure all has went as it should have, and even send a doctor's note upon request. Imagine if you came home from work with a scratchy throat. Would you rather live with your current choices and go to emergency room dealing with that all night, or take a home remedy and be sicker in the morning? Or would you rather just pick up the phone, call our service, and within an hour or so get a prescription filled and be off to sleep and rest and be ready for work in the morning? And what if that wasn't you that was sick, but your child with a high fever in the middle of the night? because every concerned parent I know would want their child to get the immediate care, but aside from taking them to the emergency room, their only other option is to risk their health further by waiting until the morning. And that's only if they can get in to be seen by a doctor that next day. And as a single parent with other children, it becomes a daunting task to go to the emergency room and get the immediate care their child needs. I understand that it's a new concept to many people, but so was computers in the 80s, Google and cell phones in the 90s, and banking apps in just the last few years. Everyone I know thought twice when banking apps were introduced because of potential security issues. Yet when they can easily and conveniently access their money by phone, hardly anyone I know ever goes and wastes 20 minutes in a line at a bank anymore, nor should they waste 6 hours waiting to spend just a few minutes with a doctor or practitioner, or even more importantly, risk their or their child's health because of a shortage of funds. Because at $19.95 a month for an entire household with no copays ever, unlimited use, everyone can afford concierge service and never ever again have to compromise their or their family's health. Or why would any employer want their key employees to take a day away from work when they could easily provide them with a 10-minute call instead? But that's just the beginning of the value of this service. What all those businesses I showed you earlier discovered is that when you ensure the primary needs in healthcare are met and make it the top priority, when you provide a no copay 24/7 health plan, it reduces the duration of illness and the chances of more major illness in the future, and in turn greatly reduces healthcare costs. The top 10 most common uses are sinus problems, urinary tract infections, pink eye, bronchitis, upper respiratory infections, nasal congestion, allergies, flu, cough, and ear infection. With immediate access to a doctor, you can ward off serious complications for minor illnesses. For example, a urinary tract infection can quickly turn into a serious condition called sepsis, a potentially life-threatening complication causing chronic kidney infection or permanent kidney damage, bronchitis into pneumonia, or an ear infection into mastoiditis, hearing loss, or meningitis. And the strep virus, possibly the most endangering of all, with a whole host of life-threatening complications, quite commonly gets self-diagnosed as a common sore throat or cold. Yet because of our busy lives and our current means of healthcare, we have all delayed care in one way or another. We work with the largest telemedicine company in the world with the highest quality of care found anywhere because they directly manage their own network of physicians. They are all board certified, state licensed, have a minimum of 15 years experience in all 50 states, and have maintained an astounding 97% satisfaction rate throughout those 8 years. We also realize that as valuable as this primary service is, it's stress that many times spawns illness in the home and workplace. So included in our service, we provide a very valuable set of additional preventative services to help manage that stress. We provide telephonic counselors for any issue in your life, a well discount card for up to 75% off prescriptions and other services like lab tests, vision, and dental care. Online work-life resources, extremely in-depth in-person counseling, resources, and guides for employers and employees on a wide range of issues from HR and employee management issues to substance abuse and more. We also provide legal and financial advisors where employers or employees can talk with attorneys or financial consultants for as long or as many times as needed, because nobody is ever very effective at work when they have a legal, IRS, or similar issues to deal with. And my own personal favorite, which is Medical Bill Saver. Hardly anything is worse than having a loved one fight for their health while in the hospital and finally get well, only to return home and realize the battle has just begun with an astronomical 10 to 40% coinsurance and out-of-pocket bills awaiting you. Have your own expert patient advocacy team take care of the details by reviewing and reducing your medical bills by up to 50% or more afterwards, so all you have to worry about is getting your loved one back to good health. Lastly, saving money is great, but whether you have insurance or not, want or need to change your insurance or not, I'm going to share with you the most compelling issue as to why your family should not be without this service. This is something that extremely few ever really know about or even think about until it's too late. However, life has an interesting way of directing our purpose, and this is something I have personally witnessed with other children in the hospitals throughout the last 24 years during my son's 67 operations, including 3 transplants, and is the greatest reason I now do what I do. And that is, I have literally seen hundreds of children suffer from chronic heart and kidney problems. And what most people who have never had a family member go through this don't realize is the majority of these children were not born with these issues. A vast portion of them actually contracted these conditions because they had what their parents thought was a simple cold that within a few days' time turned out to be a virus or strep that settled into an organ and completely destroyed it forever, and left them where numerous surgeries, dialysis, heart machines, and/or transplants were their only saviors. Lifelong illnesses that nobody ever wants to go through. And I'm sure that we've all heard how bacteria and minor abrasions and cuts that can easily be handled through our service result in the similar catastrophic conditions with loss of limbs or life when not treated with antibiotics immediately. Or have a stubborn person like me who had a heart attack several years ago and was minutes from losing my life because I waited for hours to get help thinking I had heartburn and didn't know that the pain in my jaw was a classic sign of a major heart attack. Recently, just this last month in August of 2015, my wife's friend's 35-year-old daughter was at the pediatrician with her 1-year-old and collapsed with heart failure and died due to an ignored strep virus that settled into and shut down her heart. And possibly the biggest tragedy is that each of these situations could have been averted or identified much sooner had we had immediate access to a doctor when it started. I do this mostly because I never want to see a child suffer or a family destroyed because they didn't have that simple, immediate, and affordable access to a medical doctor without a copay. And believe me, these are things that nobody ever regrets until it's too late, so do it today. At $19.95 a month for the entire household, without any copays ever, we can all afford the right choice. Total peace of mind that your whole family is protected for the majority of reasons you will need a doctor this year for less than 1 soda or cup of coffee at just 67 cents a day. And as an added bonus, all enrollees will receive weekly healthcare updates and a free copy of my upcoming book, The Secrets Healthcare Providers Don't Want You to Know: Optimizing Your Health Insurance Plan. In this book and our weekly updates, you will discover the secrets that hundreds of high-profile businesses, including the ones I showed you, and thousands of savvy individuals are using to cut their premiums, deductibles, and copays in half or more while receiving higher valued healthcare. To enroll, all individuals and families just copy or click the link below and then scroll down and click Plans and Pricing and then enroll today. Or call the person below. For all employers, please contact us via email or phone for company setup. Thank you, and we look forward to serving you in the future.